Hi everyone, welcome to week number 6. This week we have 2 chapters to discuss and to focus on. So that's going to be chapter 49 and chapter 51. Now chapter 49 is talking about radiology and chapter 51 is focusing on pulmonology and the pulmonary function. For this week's video, I'm only going to talk about chapter 51. And it will be your responsibility to still read both chapters, though. So chapter 51 is talking about pulmonology, and pulmonology is the study and treatment of diseases of the respiratory system. This will include the areas of the trachea, the bronchial tubes, the lungs, and the alveoli. The primary function of the respiratory system is to transport oxygen from the lungs through the bloodstream to all the cells in your body and to carry waste products from the cells through the bloodstream to the lungs to be exhaled out of the body. So kind of like when we learned about the bloodstream last week, how your blood comes from the heart to the lungs, then back to the heart. It's the same process, okay? As a medical assistant, you will be responsible and play a very important role in helping the provider to diagnose conditions and diseases of the lungs. This can be done through what we call a PFT, or a pulmonary function test. A pulmonary function test may be performed when a patient complains of shortness of breath or difficulty breathing after minor exertion or minor exercise. It's also performed on patients who have asthma, chronic bronchitis, emphysema, or cystic fibrosis. Medical assistants can perform these exams within the office. They don't have to be in some specialty office. And a pulmonary function test will really evaluate the lung volume and the capacity and show any alterations in the total lung capacity, the inspiration capacity, and the vital capacity of the patient's lungs. There are several types of pulmonary function tests that can be performed. Those are things such as a spirometry test, arterial blood gases, lung volumes, pulse oximetry, diffusion capacity, and cardiopulmonary exercising tests. So let's talk about a couple of these. Let's start with a spirometry test. Now, a spirometry test is a non-invasive test that measures the patient's ability and the ability of their lungs to exhale oxygen and exhale air out. The result reflects the elasticity of the lungs and their ability to ventilate and the strength of which that respiratory muscles work under. As a medical assistant, you play a very important role during a spirometry test. You are the patient's coach. You're their cheerleader. So while they're actually performing this, you really want to encourage them. Tell them, keep going just a little bit longer, breathe harder. Give them good coaching tips to help carry them through that procedure. Arterial blood gases will measure the amount of oxygen, carbon dioxide, and the pH level of the blood. This really is a test that we do to help diagnose patients with COPD and patients with pneumonia. This really needs to be done by a specialist, as you will puncture an artery. So you don't want to just go in doing that blindly. You really want to have somebody who knows what they're doing perform that exam. Your lung volume tests are done with a peak flow meter, and this will actually measure the patient's ability to move air into and out of their lungs. This is really done for asthma patients on a daily basis to help monitor how their asthma is going. And the last one I want to discuss is a pulse oximetry. Now, this will actually determine the oxygen concentration in the arterial blood. This is done with a device that can get clipped on the finger, a toe, or the earlobe, And what it does is it will actually monitor that oxygen saturation level. You want to make sure that your patient's fingers are warmed up and there is no nail polish on the finger. You want to make sure that it is a clear nail. And it's really important to know that normal oxygen saturation is between 95 to 100%. If it's less than that, the patient might be having some difficulties breathing and may need oxygen to help with that. Alright, so this is where I want to stop for this week's video and this week's overview. As I've always said, please make sure that you read the chapters fully, as that will help you with your discussion post, your quiz, and your written assignment for this week. So let's talk about each of those. So for this week's discussion post, you will be focusing on that pulmonary function test and spirometry testing. You will need to discuss what you think the patient preparation is needed for performing these exams. What do the patients need to do? You will also need to discuss what you think the importance of coaching is and when that coaching is appropriate. Please make sure that your initial post is set up and completed by Tuesday at midnight, and then your 2 responses to classmates need to be completed Saturday by midnight. For your written assignment this week, you do have one of them, and it is composed of 2 parts again. So you will need to submit both parts into a zip folder, and then it will be a one-time submission, or only one submission. And that's going to be due Sunday by midnight. So part 1 of this assignment will require you to discuss the factors that increase the patient's risk of developing diseases in the respiratory system. This paper is only going to be about 1 page in length. You need to write it in APA format. And what you'll do is describe 2 factors that really increase the risk of patients developing and obtaining lung cancer. Now for part 2 of this assignment, you will need to download that medical abbreviation worksheet that you can find in Angel, and you're going to fill in what those abbreviations mean. So if you saw those in a chart or if you saw those in some sort of documentation, what would they mean? This week, the first part of your course project is due. Now remember, you had to pick 10 diseases off of that list that I gave you in the beginning of this course, and you're going to create those 10 appropriate Word documents that follow them. Each disease had several pieces of information that needed to be part of that documentation, so please make sure that you have all of those completed. All 10, complete them as one submission Sunday by midnight. And lastly, for this week, you do have one quiz. This quiz will be over the chapters that we've reviewed tonight, so that's chapter 49 and 51. Your quiz will be 10 multiple choice questions with a 10-minute time limit. Please make sure that this is completed Sunday by midnight as well. Alright guys, that is all I have for you. I hope you all have a wonderful week, and I'll see you on Tuesday. Bye guys.